All right, welcome all. We're happy that you can join us on a Tuesday night. My name's Alex Stratford. I'm going to be your moderator for tonight. I also have two distinct roles. I happen to be the Executive Director Registrar with the Nova Scotia College of Social Workers, and I have the privilege of being able to chair the steering committee for the Nova Scotia Action Coalition for Community Wellbeing. Like to start the night by recognizing that the Nova Scotia Action Coalition is located in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq. All people in Canada have treaty rights and responsibilities. Those who have settler, arrivant, and refugee origins are challenged to collectively work towards reconciliation with Indigenous peoples and communities. Even as we reckon with our roles in residential schools and other colonial projects designed to displace, dispossess, and disempower Indigenous peoples, we are also embedded in communities that are grappling with their own roles in the great and necessary labor of reconciliation. A particular time in Nova Scotia as we see fishing communities struggle through conflict and crisis worsened by the intersection of the pandemic, economic uncertainty, and racism. We are confident that together we can find a way to desperately create the change that we need to create. The coalition, again, has been working for the last 3 years to build an anti-poverty coalition. We're a coalition of community members dedicated to working strategically and collaboratively toward community well-being and a better quality of life for everyone. We exist to connect a community of action-oriented organizations and people who are committed to social inclusion and building a Nova Scotia where no one lives in poverty. If you're interested in the work of the coalition, we will be sending an email out after this webinar series. We'd love to hear from you and stay connected with you. This is our fourth webinar in a series of webinars in which we've been talking about the impact of COVID-19 and some of the opportunities that it does present as well. Nova Scotia went into the pandemic with high rates of income security, poverty, with a significant portion of our workforce making very low wages, a scarcity of affordable housing, significant housing and food security issues, increasing homelessness, as well as a crisis in our healthcare, childcare, and elder care systems. The fragility of our current income security and care system need to be exposed, and government's policies, programs, and delivery mechanisms reimagined. COVID-19 recovery provides an opportunity to do this. And as we use these learnings to create a more equitable and inclusive society, we hope that we can mobilize others to join us in a call for a society where no one lives in poverty and where we have greater equity. Again, our goals for tonight are to talk, and Rajean Willis is going to introduce this topic for us in a minute, but we want to talk about the 400-year pandemic and exploring anti-Black and Indigenous racism post-COVID-19. In July, the Association of Black Social Workers declared that people of African descent have been living in a global pandemic for over 400 years and called on all organizations to join them in helping to dismantle the system. The injustices of systemic racism continue to plague our communities in every facet of our lives. What is happening in the United States of America is not a new reality, and people of African descent living in Canada and here at home in Nova Scotia have endured psychological trauma of racism for generations. There must be a committed fight to address the social injustices of racism in an effort to support the healthy development of Black and Indigenous Nova Scotian communities. This requires all organizations and people to raise their voices and demand structural change. Without further ado, I'm very happy to welcome our speakers for tonight and to really pass over the floor, or the screen as it were, to them to really delve into these topics. So I'll introduce Rajean Willis, who's the president of the Association of Black Social Workers. She's been a practicing social worker for 8 years and works in community mental health sector. She's been involved in trailblazing COVID response work for African Nova Scotian community. And Rajean is passionate about serving the diverse and unique needs of the Black community. I'm happy as well to welcome tonight Chief Andrea Paul. Chief Paul was born born, raised, and a lifetime resident of Pictou Landing First Nations, attended Ontario Native Education Council as a certified counselor, and graduated St. FX with a BA and a BEd. She's married and has 2 grown children, Selena and Lindsay, and is very passionate about her role as an educator and a leader. We're delighted tonight to be joined by Al Jones. Al Jones is a poet, educator, journalist, and abolitionist living in African Nova Scotia. She was the 5th Poet Laureate of Halifax. In 2016, Al was a recipient of the Burnley Rocky Jones Human Rights Award for community work and work in prison justice. She's a co-founder of the Black Power Hour, a live radio show with incarcerated people on CKDU that creates space for people inside, share their creative work, and discuss contemporary social and political issues. Al served as the 15th Nancy's Chair of Women's Studies at Mount St. Vincent University for the 2017-2019 term. Al was the Atlantic Journalism Award winner in 2018 and 2019, and I would like to pay tribute to the many nameless and unrecognized women whose work makes it possible for her to be here today. Al, thanks for being with us. Finally, Jackie Barkley is a social worker and therapist with over 40 years experience. She's worked in child welfare on the child protection team, excuse me, of the IWK, as a clinical therapist with the Choices Adolescent Treatment Program, and on the short stay psychiatric unit at the Nova Scotia Hospital, and as a mental health crisis worker at the IWK Emergency Department. In the past 10 years, Ms. Barkley has provided counseling to the Department of Community Service Child Protection clients, completed parental capacity assessments, and is registered with Family Court for the provision of custody access assessments, and has been a therapist for individuals with the Provincial Victim Service Program. Jackie's also written and presented workshops extensively over many years regarding anger management, white privilege, culturally competent therapeutic intervention, and contemporary parenting analysis. She is lectured at Dalhousie University, Acadia University, and Harvard. Jackie is actively involved in her community as a longtime activist and advocate regarding anti-Black racism, poverty, and anti-colonial issues involved with Indigenous rights in Canada. Welcome to everyone. This is normally, if we weren't in a COVID situation, where we'd have a thunderous applause and feel the energy of that in terms of welcoming you all. I'm gonna welcome Rajean to walk us and introduce us to tonight's conversation.
All right, thank you, Alec, for inviting us to be here. And I'm so happy and pleased to be able to share the screen with these phenomenal folks here. So I am going to share my screen. I have a few slides that we'll go through just to sort of set the context of what I'm going to speak to tonight. And that is understanding the state of the health of African Nova Scotians in this province, of course, previous to COVID, and then also recognizing what unique needs the community required during COVID when we first seen it on the rise in April, and then what our next steps are for moving forward. So just to give a little bit of background, as mentioned, Alec had said that I'm the president of the Association of Black Social Workers, but I also played a role in our COVID response initiative in terms of being on the ground as a community intermediary. So I was able to kind of be that link between ABSW, which is the Association of Black Social Workers, the Health Association of African Canadians, otherwise known as HAWC, and other partnering organizations that later formed this team to respond to the needs of the community. And so community was really very much a part of this whole process and needed in order to ensure that this was going to be something that was going to be successful. So just, you can see here on the screen, everyone can see this, correct? Okay, so we recognized in March that COVID-19 was something that was in our province and was beginning to show itself in a really sort of aggressive way. The Health Association of African Canadians used Zoom as a way to inform the community as to what was going to be taking place with our provincial protocols and what we're going to do to try to protect ourselves. Now, recognizing that people of African descent in this province have been, here and made our presence for over 400 years, there's been many inequities as a result of anti-Black racism, and healthcare has been one of those areas that folks have explored. And anecdotally, we know that people of African descent are at higher risk for certain chronic illnesses and things like that. So the Association of Black Social Workers, being an organization that is community centered and created to meet the needs of the African Nova Scotian community in diverse ways, we knew that when this state of emergency came into play, we had to be there to respond. We had to not close shop. We had to actually promote ourselves even more so for folks to know that we're a place that you can access for what you need. And so with that being said, we started a toll-free line on April 1st. Learning about what has happened in the States with communities of African descent, we had to prepare in the event that we might see numbers, similar in respect to our per capita ratios of people of African descent in this province. And so we had to, prepare ourselves in a way that knowing that there are health disparities, we have to see what we need in place to be able to address these and advocate for people of African descent. So hence the toll-free line was started. It was a place for people to be able to call in to access any services that we might have had available or that we knew of. And I'll get into some of that soon. And the HAWK and ABSW team led this initiative, and our response team was formed with other partners. This is just sort of a breakdown of who we had involved. We had a health coordinator, we had a coordinator from our African United Baptist Association, educational consultant, the African Nova Scotian Affairs, we had a representative from them, and Department of Community Services also played a great role in this. And as I mentioned, community was really a part of this in terms of our community coordinators, which were representatives that could speak on behalf of all of the communities in our province, but specifically the Preston Township was something that we really focused on in the beginning, at least. Oops. So focusing on Preston Township, we had Cherrybrook, Lake Loon, North Preston, and East Preston as our areas where we had to create wraparound services to, not necessarily shine negativity on the community in the sense that we saw some spread happening, but to ensure that they had the resources that they needed to stay safe, to be able to not even just consider their physical well-being, but psychological, mental, emotional well-being also. African people are very relational, and so it was very difficult for us to have to be separated from one another, even to think about our Sunday church services for, the church being the center of the community. It was difficult to understand how to still be true to who we are and be community oriented with having to follow these limitations and restrictions, and how do we navigate that? So as I mentioned, it was initially the Preston Township focus, but then we realized that we need to make this provincial. We didn't have many calls coming in province-wide in the beginning. However, we wanted to be proactive as well, to be able to provide what is needed in other parts of our province, because we recognize that African Nova Scotian communities are not just in HRM, but they're across the province, and there are unique needs to different communities as well. So this presentation I sort of took, I'm trying to move my video coverage around the screen so I can see it completely, but this is our sort of standard presentation that we use when we're helping people to understand our response to COVID-19 in the African Nova Scotian community. And so I wanted to provide this, I guess, so that folks can see on screen, but also just have a conversation around some of this. So again, as I mentioned, understanding the health inequities as a result of anti-Black racism in this province, not even to mention the other inequities that we see, such as the lack of resources within community to be able to create for ourselves in a way that's supported and sustained more broadly than just within the community. Um, we have to understand that there was a need to also provide education in culturally relevant ways to the community. So we had a team of folks that were able to create communications that were going to speak to African Nova Scotian and African Canadian people in a way that they were going to understand. There was going to be posters with pictures of people of African descent on them, so it's relatable. Often we think that information that's translated should just be understood by anybody that sees it, but we don't recognize that knowledge translation has to happen in ways that meet those that are receiving that information. So that was something that we really seen the gap area, and something that we needed to address, even in terms of the provincial updates that we saw daily during the initial phases of COVID. It's one thing to explain that there is a cluster of cases in a certain area, but not necessarily recognizing the harm that that might cause by placing that sort of burden of irresponsibility in the words that were used in some of the cases on this marginalized or community that has already had tons of negativity shown on them and has been shamed and blamed for many things. So we have to understand the greater picture and be able to, as a result, in turn, our responsibility was to be able to challenge those things with solution-focused strategies that were going to be a better fit. So as you see here too, I was able to update this to today. We have had 1,324 calls that have come through that line. And, they're not all calls that, again, are people that have been tested positive. Some are just, I'm struggling with dealing with the pandemic, on top of Black Lives Matter movement, and, on top of life, and the fact that this isn't new for people of African descent to be experiencing episodes of people not understanding what Black Lives Matter is, and seeking to understand that, but not knowing how to do that in appropriate ways. And it's really exhausting and draining for people of African descent to continue to have to convince people of the racism that we endure on a daily basis. And so some of the calls were just to let it out, and to see what is there out there that can help us to get through these tough times. Some of the resources that we were able to provide through our partnerships and folks that had called in the line. So the process was that you would call to the toll-free line if you were in need of some sort of resource. There were different phases where we had different sort of guidelines put in place. So for some periods of time, you had to actually have been tested and required to self-isolate in order to kind of be eligible for some of the services. and others we were just able to provide regardless. And part of that was, again, the wraparound services for everyone's health and safety, to ensure that if we're asking folks to stay home, where in some instances they may not have any other option but to go out and do what they need to do to provide for their families, or whatever situation might occur, what can we do to help them to be able to isolate successfully in a way that they're still going to be taken care of, that we were able to provide. We had, I guess, versions of how we could provide food services to folks. We were able to provide food boxes, other supplies such as masks and hand sanitizer and other sanitation supplies. That was a big request. A couple of things I want to highlight, and this kind of speaks to what we're seeing post-COVID and what we're able to provide and respond to post-COVID, is the mental health counseling, the spiritual counseling, and our grief yoga and meditation. So sort of looking at that aspect of wellness. And we're using virtual means to be able to provide these things, but we recognize that there are folks that need mental health support, that need that spiritual boost that they may have been lacking as a result of not being able to fellowship together with folks. There's been services that have moved to online or other spiritual means, but that, again, central part of the community. Yoga and meditation. We wanted to see this opportunity, or this time of COVID-19 pandemic, to bring about opportunities for us to be able to introduce new things too. So in thinking about meditation and yoga, why not create opportunities for folks to learn some new practices, or to re-engage themselves with things that they might have done in the past, recognizing that many of these things are innate to us as African people as well. Alec, let me know about my time.
You're doing
So,
great.
okay. And there'll be time for questions later, I'm sure, if you have any. Just a picture of some of the stuff that we were able to get. And again, this is where we talk about allyship and partnership, and a true understanding that when a need arises, we have to collectively come together with whatever resources we have, recognizing that some resources might be greater in terms of what they can do with them, and to be able to create teamwork so we can respond. And I'm sure we'll hear more about allyship later on. Again, opportunity to support local businesses during this time. As we know, COVID-19 has been very challenging for small businesses, especially when we're being asked to close down. As we heard today, there's new protocols coming in place again. We were able to, as a way of showing our gratitude to community for coming together and helping to stop the spread, because we have to recognize that it's an individual decision that we all have to make to do what we need to do to protect ourselves and others. But when community really can come together and slow the spread the way that the Preston Township was able to do, specifically speaking about them, we have to show gratitude for that. And so, a small token to be able to provide a local food meal to those folks, but just something that we were able to do. So again, we're using virtual ways to be able to respond to COVID, but to educate others as well around what some of the work that we're doing. This is really trailblazing work. We've been able to have meetings with folks across the country, and it's been recognized that there's no other community-led type project that's happening in such a way as this, in particularly with folks of African descent. And so that's something that we're proud of, because we've been able to create a sustainable model that can be used for any type of emergency that could happen within the African Nova Scotian community, because we've built the networks and the connections of folks across the province that have been able to assist in this initiative, and have recognized the power that can happen when we all come together to respond to the needs. There was a feature that we had in the newsletter, or I think it's actually the Connections magazine, with the Nova Scotia College of Social Workers. So if you want to learn a little bit more in detail, you can check that out. And as I mentioned, we do have, specific, culturally specific health flyers, which has been an ongoing thing that folks have advocated for within different systems around, culturally relevant representation in those types of things as well. Research initiatives. Some of you may have saw that there are a number of different research projects that are also on the go. And so we haven't necessarily taken on research ourselves, but we have, led some of our knowledge with those folks, and have partnered in some also. Research is important because we realize that through this initiative, we've learned a lot, and there are still gap areas as well. And so we need to be able to have this concrete data. And one of the biggest asks is for race-based data collection, to help us to understand and to really provide evidence that these health inequities do exist, and this is the scientific evidence that that's the truth, since you don't want to believe our anecdotal data, and here is what we need to respond to that. So the benefits of having an Afrocentric or community-led model is that it's holistic. So you've heard me talk about some of the ways that we've had a holistic framework. It's a template for future provincial emergencies, which is something that we really feel strongly in. Support for many levels of government and community. And again, just building and strengthening the relationships between government and community. And communities, of course, working hard to level COVID-19. So I think what was important for us in all of this is that, we can't just come from a top down. It has to be community led. It has to be community driven. We have to hear from community. We have to know what it is that is going to assist them in the best way from them, and to have folks on the ground that are ready and willing to assist. Some of the challenges that we've recognized, again, there's a lack of COVID-19 data, or that race-based sort of health data that we have been looking for years. Sustainability of resources. So fortunately, we were able to gain a lot of funding through grants. However, often these are one-off opportunities to provide resources, and then we have to seek out more funding to continue that or to be able to offer something else. So that's always something I think that community organizations run into. And of course, structural racism. So again, the Black Lives Matter movement happened right in the middle of this pandemic, but as the topic of this series is, the 400 year pandemic we've been living, we've always had, unfortunate opportunities when it comes to equity. There has not been equal access, equal opportunity. There's always been this overtone and overt and subtle uh, wave of racism against Black people in this province from our first arrival here, our settlement here. Folks don't even know that slavery against Black people happened in Nova Scotia. And so this is something we're combating daily. And, I think it's becoming more eye-opening to some folks, given that we've had the Black Lives Matter movement really ramp up. But again, this is nothing new for people of African descent. And, as that sort of um, finds itself in the background when other things start to surface in front of it, we have to remember that people of African descent have really helped to shape this society, this economy. We deserve equity. We deserve equitable access to healthcare, education, any type of economic, and this is something that we're still fighting for to this day. So what we know and what we've always known is that when we're addressing issues or coming to the table with solution-focused ideas, they need to be culturally specific. And also this is, of course, important when delivering programs. We have to be responsible stewards of resources to meet the real needs. So again, there's a level of need assessment that has to take place, but also a cultural understanding of these needs and how to be able to meet those needs. We have to understand the historical and present day structural barriers and racism, racist attitudes, and systemic racism that is in place in order to understand the needs of our people and to adequately respond to these needs. We have to be able to advocate for the resources for communities that are underserved. And that is something that we just continue to fight for and will continue to fight for.
Rajean, just a couple more minutes.
Okay, I'm coming to the end.
Okay.
So just again, as I mentioned, we did have some funding opportunities that African Nova Scotian Affairs was a main source of funding in the Department of Community Services, which again, as we move forward, our line is still open. We have been receiving fewer calls, but we have things in place if we are to see an increase in cases again or needs in the community. And, I'm talking about COVID-19 here, but as I mentioned, we recognize that there are lots of areas for opportunity to continue to provide services to members of the African Nova Scotian communities in the interest of our health and well-being. And I think that's it for me.
Thank you so much, Rajean. And we are going to have time for more comments and questions. I know I have lots. There's a comment there from Colleen already just saying that it's a really great example of a community-led and Afrocentric model. So thank you for sharing that with us. I'm going to come to Chief Andrea Paul next, who's going to tell us a bit of a different story, but also a very connected story in terms of the racism and discrimination that Pictou Landing has felt and what it took to resolve that. So Chief Paul, I'll invite you to speak next.
Good evening, everyone. And Rajean, that was really, really informative. Thank you for sharing that. And I just wanted to say thank you for the invitation tonight. So I'm going to speak a bit on the environmental racism that Pictou Landing First Nation has endured since 1964 with regards to pulp and paper in our community. And I think, a lot of people definitely know about this situation. And it started in 1965. And the tone of that, even, I was just digging out some papers here, and in 1965, they have a letter from the Maritime Regional Office, and talks about this is so early, and this is how they talked about the community. Unfortunately, they, as well as a number of the Indians, were somewhat intoxicated, which made the meeting a bit hard to control. However, it did not get out of hand, but it was a bit hard to concentrate on the business of the evening for a brief period. From there on, it was fairly smooth. And this is in an old government document. And I remember reading that, and it really bothered me as to how the people from my community were portrayed. And because you've often heard the terms that, you know, he's just another drunken Indian and things like that. So when you read that in a document, and then you see the history of what has happened in Pictou Land and with regards to different mill owners and different governments, with how they reacted and dealt with the issues of Boat Harbor, it definitely displays and shows the environmental racism that we have had to endure for so many years. And for so many years, we had different levels, or different chiefs and councils that never let this issue off the table. They continue to try to right the wrong that has happened to our people from this. And I often talk about, a lot of people will talk about the pollution side of it. You know, there was the air pollution and the water pollution and the land and all of that. But a lot of people don't talk about the racism that we endured as First Nations people and the impacts that it had on us because of our inherent way of living was with the water and the land that we were surrounded by. And so I grew up and it was already polluted. So in 1971, I was born. And so I grew up to the pollution. I've never known it to be any other way other than polluted. My parents, they would have enjoyed Boat Harbor in its prime, and my grandparents would have enjoyed it in its prime. So growing up, I never really knew much about Boat Harbor. It was something that we didn't really talk a lot about. We knew it was polluted. I guess there was a lot of things that for me, I can say I didn't really understand until I got older and listening to elders and listening to community members about how Boat Harbor has impacted them. So over the years, one of the things that I really learned was the devastating impact it had on our language and our cultural beliefs and our traditions, and the things that would have been passed down to us that just ended. It just stopped. All of that didn't continue. And one of the things I also noticed was the language of how it was talked about. So in my language, they called it Oseg, it means the other room. So it was literally an extension of the community. That's what this place was. It was an extension of the greater, of this smaller community. And it was a safe place. It was a place for gathering. It was a place to get your food. It was a place of well-being. It was a place of being together. One elder a few years ago described it as it was full of safety. It was somewhere that they knew that they could go and they felt safe. They knew that if they were hungry, they could go there and gather some fish, or even when Indian agents came, she knew that that was where they would go to hide from Indian agents so they wouldn't go to residential school. And so she said, when Boat Harbor got polluted, she said it was like losing a parent. And that was the first time I ever heard it described that way, how absolutely painful that would have been. And for them to go down and to get to the waters and see all the fish that are dead and you know, the devastation that would have had on them. And so over the years, I still speak my Mi'kmaq language and I can understand the Mi'kmaq language. So when I get to be around a group of Mi'kmaq speakers who are usually the elders and they talk about Osig, and you can really see the joy when they're going back in time and they speak in their Mi'kmaq language and they're telling their stories and they're happy and it's just so beautiful. And then when you say, well, what about Boat Harbor? And you can see the shift, everything just shifts. And even the language shifts from Mi'kmaq to English. And they talk about, you know, it got polluted and you know, the language it then has a very negative undertone. And so when you think of somebody like me that was raised into the pollution, that was the language that we got, was you don't go there, it's polluted, it's toxic, it's not safe. And so those were the words that their language shifted, their trust shifted, things that they knew to be true all changed. And that had a huge impact on the community, for sure. And then there was the issues of working with governments and working with different mill owners about dealing with Boat Harbor and putting a stop to the pollution. And, you know, there were different times when different promises were made and promises were broken. It was constant disappointment. So in 2014, everybody knows it's when we had the big pipe break and Pictou Landing came together and blockaded the area, which was actually Indian Cross Point, which is an Indian burial site. That's where they put that pipe. And so when the pipe broke, we weren't even told. I happened to find out through a message. Somebody messaged me and said, I think there's something going on. And so growing up, like I said, we weren't really told a lot about Boat Harbor. So when I became chief in 2011, I didn't really have a relationship either with the mill at that time. There weren't really any conversations happening. 2014, I learned of something happening, maybe a pipe leak, and I had no idea where the pipe was. Like, I've lived in this community my whole life, and I had no idea where this pipe was. And so I had to ask somebody, do you know where this pipe is? So they drove me in, and I didn't know what to expect. I was expecting like maybe, you know, a trickle of I don't know what I was thinking. But when I got there, it was like a water fountain, a black water fountain of water. Just, it was, and hot, effluent. And so when I got there, that's what it looked like. And I was like, holy smokes. And you could see it trickling down into the East River. And it was shocking. I remember being so shocked. And I said to them, I can't believe you didn't notify us. And then they said, we didn't have to notify you. And I'm like, but it's on Indian Cross Point. And so anyways, that's when we quickly decided that we were going to use this and leverage it to our advantage. And we quickly blockaded the site and allowed for remediation of that break, but we didn't want them to fix the pipe. And so that was the whole premise of our blockade, was you can clean it, but you're not fixing it. So people were there 24 hours a day, making sure that nothing was getting repaired. And we started having negotiations with the government, with the provincial government. So after a week, we did come to an agreement in principle, and there was a lot of mistrust. It was really scary to believe that the government was going to commit to something. And the commitment was that they were going to come up with legislation. So for the next year, we worked together with the government, and the Boat Harbor Act was passed in 2015. So the government legislated that, And we started a committee called the Boat Harbor Cleanup Committee, the remediation project. And we did some engagement. We've done a lot of engagement with the community, and there was still a lot of mistrust. People didn't believe that this was actually going to happen. The legislative date was January 31st, 2020. There were people in the community that felt we've been down this road, you know, things are going to change and they're not going to stick with the date and there'll be an extension. And there was a lot of fear and a lot of worry, which is very understandable. So throughout the last, I would say, about 4 years, we really started developing strong allies outside of our community and building relationships. So we were building relationships with the fishing community, with our surrounding community, and we realized that a lot of people felt the same way about this whole issue of the pollution and how wrong it was and how we were treated very unfairly. And even in a documentary that was done back in, I think it was in 1985 or 1986, and it was called The Deal by, I think it was Claude Vickery was the guy in the video. And so I like the video because it interviewed people that were actually involved at the very beginning and how it all went down. And there's one part in the video where they interview Mr. Wigglesworth, who was with the Water Authority. And I remember the first time I watched that video, and I was sitting with a group of women. We were at a Native women's retreat, and part of our retreat was to watch this video because we were doing a lot of work on Boat Harbor and building relationships with Dalhousie University on research methods and stuff. And I remember we were sitting there watching the video, and it got to the part where he asked Mr. Wigglesworth, "What about the Indians?" And he says, "Well, they didn't live in the water. They lived at the water." And then he says, "And so what?" Right? And I remember how much that bothered all of us. We were just like, "Oh my God, I can't believe you just said that." Mm-hmm. And so it really tells you there was absolute disregard for us living there. It was there because it was just a small group of Indians that were living in that area. And which is unfortunate. And it took, then the term environmental racism came into being, and there was a lot of work that was done by Ingrid Waldron. She wrote a book, and I remember when she got a hold of, I was newly, a new chief then, and she had reached out, and we had already done a lot of sessions with the community, and a lot of community felt very tired because there was a lot of people that wanted to do research and wanted to do studies with us. And so I remember the timing was just off. When she reached out, it was at a time when community was just like, oh, we're always being researched, right? So the elders would say, we've given out so much PhDs, right? Is how they would look at it. And then they say, and then you don't see them again, right? So so we didn't actively take part in the study in her research work, which was unfortunate, and because she does such beautiful work. She's done a lot of great advocacy work on this, and got the attention of Ellen Page. Documentary was done, really great documentary on There's Something in the Water that really showcases the environmental racism that's in Nova Scotia. And so it even took me a long time as a leader to say it was environmental racism, because I was working with the government and I didn't want to offend the government. So I felt like I had to be careful about how I was approaching it. And it's kind of unfortunate, right, that I couldn't be my own, like I couldn't be true about what I was feeling. So I didn't say it that way. It took me a while before I would say it. And when the premier actually called it out as environmental racism, it was just like, oh my God, right? It was, I don't know, I just felt this was huge acknowledgement on the government side to talk about that. And so there's been a lot of work that we've been doing with the provincial and federal government on this file. We're actually undergoing a environmental assessment for the remediation project right now. And I always say, there's so many great learning tools that are happening here that could be used for all First Nations across Canada, right? And what's unique is that usually, you have an EA because there might be detrimental impact to treaty, and we're actually reversing that and remediating something. So I think it's a beautiful project. The people in the community are feeling, well, now they know it's actually going to happen. So one of the things that has happened recently is the pipe has been removed from Indian Cross Point. So from East River to the road, that whole pipe has been removed, and that's a huge reclamation for us, and we're able to get that place back. And I think that's really important for not just Pictou land and First Nations, but for a lot of for Indigenous people, period, right? And the other piece is that once this remediation is done, there's going to be access. There's going to be great access to lands and to the water. And so I often get excited because although for me, my whole life was on the pollution, and I'm going to be 50 in January. By the time this remediation is done and things are starting to really get underway, I'll be an elder in my community. And what excites me is that the children will no longer have to deal with this fight, and for them it's just going to be opportunities now and access to things that we never had access to. I've never been able to have access to those lands or to that water. And just the other day, I got a message from one of my friends. She said, have you been to Point D? So Point D is where it meets the Northumberland Strait. So she says, have you been to Point D? And I said, no. And she said, oh my God, you'll need to come and see it. There's eagles everywhere. So I went down, I was in town. And so I told my husband, we got to drive down. I got to check it out. At first I didn't see them. I saw one and I was like, looking. And then, cause they were quite a distance away, like over the water. And this is in the lagoon area, not going towards the Northumberland Strait. And then I just saw them. And it was just, I don't know how many eagles. And it was just, I was just so blown away by I've never, in my 49 years of life, well, I guess I would be like less than that. I wasn't there when I was a baby, but never seen that. In the summer, what I noticed was the seagulls on the other side of the bridge, and so many seagulls, and they're feeding. Because there's so many fish there now that never used to be there. And so I get excited about this. So in the last 9 months, I've gone into Boat Harbor quite a bit just to capture the changes that have been happening in there, because we've had a lot of, this whole piece has been very difficult on the community. So to be able to go in and just capture the little changes that are happening and to show that hope is very important. So
just a couple more minutes, Chief.
Oh, sorry.
No worries, just wanted to.
So this whole piece is definitely addressing the environmental injustice that has happened to us, but how we can come together with government and also with the mill to address these issues. Because in the last I would say during COVID is when we've had, well, I know I've had good conversations with the mill and having real conversations, because there was a lot of other racism that came out of this, because once it was announced that there was not going to be an extension, and once the government announced that they wanted a full EA, there was a lot of negativity towards Pictou Land and First Nations. And there were a lot of threats being made. There was a lot of very, very racist comments that came out. It got to the point where it was absolutely, for me as a woman, as an Indigenous woman, was absolutely terrifying. It caused me to not go anywhere from December, January, like to the point where my work put cameras in my car because I traveled quite a bit, because the threats were just, some were really horrific. The things that were being said. The community, we hired our own security to watch over the community from January for about, I would say, for about 5 months. So we would have security at either end of the community just to navigate traffic and make sure that everything was safe, because there were a lot of threats being made. And so I remember when the Premier called me and we were talking, and I said, you know, from 2014 to December 20th, not once was I ever fearful. Not once was I ever scared. I would get a little uncomfortable. You know, my anxiety would go up a little bit if people would ask me, are you Chief Paul? You know, if I was in a public place, because I never knew, like, what were they going to say? But it wasn't nothing that was terrifying. It was terrifying after December 20th, like absolutely terrifying. And I never felt that kind of fear. And it got to the point where I had to like completely hide from, like, I had media, social, I had the news constantly wanting to talk, because we were coming down to our shutdown for January 31st, and I was avoiding everyone. I said, nobody needs to see me in the news. I was absolutely staying low key, right? Everything I did, I just did, you know, if I was recording things at Boat Harbor, it was just for the community. So I was avoiding the media, and then I was starting to feel, you know, I'm good. And then in June, I received the letter in the mail with the noose, that picture. And I was just like, oh, but you know what? The first time I actually spoke was at a Black Lives Matter rally in New Glasgow. And I was invited to say, I thought was a land acknowledgement. So I was really nervous going. And because it was my first time going to speak by myself. And so when I got there, and my friend was there, and I was like, she could tell, she knew I was really nervous. And so anyways, she said, you're just doing the land acknowledgement, that's it, right? So I was like, okay. So I got there, and then they were like, oh, and Chief Andrea's gonna, you know, say a few words about racism. And I was just like, oh, I am? Like, I was not expecting it. So I spoke, but did not talk, did not go anywhere near our mill topic, nothing. I didn't go there at all. And when I left there and really just looking at everything, and I felt so empowered by the, you know, I stayed for the whole event, and I listened to every speaker and every singer, and it empowered me at great lengths, that when I got home, I shared a little bit of my story, and I said, you know what, being silent isn't helping, and not saying anything is not helping. And I really have to talk about it, and I have to address it, because this is going to happen somewhere else, right? And we have to have those hard conversations. And so from that point forward, I felt stronger. I felt like, you know, I got my strength back, and I was able to stand up tall and say, you know, you're not going to knock me down. And all I ever did was advocate for the community and fight for justice. And there was nothing wrong in that, right? So anyways, that's a little bit about the environmental racism. And I just want to say thank you for allowing me a few minutes to speak.
Thank you so much for sharing that story.
You're welcome.
There's a couple of comments just about how your description of the Eagles returning brought tears to folks' eyes. I also think your story shared the impacts of this struggle personally on leaders like yourself, on the very much the racist reactions that people turn to as we create this change. But I think there's a lot of learning and a lot of hope in your story as well. So thank you for sharing that. We're going to come next to Elle. Elle, thanks for being with us tonight. Happy to have you take the stage, as it were.
Thank you. And thank you to all the presenters and the coming presenter. I'm going to talk about particularly policing in the pandemic and the links between COVID, incarceration, and particularly how that works through hygiene arguments. So people may not be aware, I guess I'll start with the one positive and keep going from there. People may not be aware that Nova Scotia actually was a leader in Canada in terms of rapid and extensive releases from provincial jail. So we were able to release 41% of provincially incarcerated people during COVID at the beginning of the pandemic. So that's the good part. That what we showed is that when there was a public health crisis, people could actually come together on all levels. It was really due to the work of advocates, particularly those in service provision, Coverdale and EFRI, the many people that provided like supportive housing and really went beyond their own mandates, for example, doing this work for men, even though their mandates technically only include women. Chief Justice Pamela Williams was very active in making sure these cases happened. And many advocates, including Sheila Wildman, who wrote cover letters to really every single person involved with like enumerated action items that each person could individually take to ensure these releases. So that's the positive, that we demonstrated that something like jail we can actually decarcerate from. The other positive is that the supportive housing that was put in place costs less than half the amount that it costs to incarcerate somebody in the province. So it costs $271 a day to keep somebody in jail per day in this province. And it costs less than $125 a day to put people into fully supportive housing, including having people in hotels, maintaining medication, having contact with social workers, etc. Of course, the province rapidly cut that housing grant after 3 or 4 months, meaning that people are now being returned to prison simply because they don't have any housing options. In the SSHRC-funded project that Alice Kashanabish and myself did on causes of women breaching the court orders, one of the #1 factors was housing. That when you don't have a place to stay, you can't be released, or you don't have stable housing that therefore puts you into a constant cycle of breaching court orders, not being able to be safe, having to live on the couches of people that may be involved in criminal activity, etc., and so forth. So the positive is that we showed in COVID that many of the things that we believe to be social sureties, like we must have police, jails keep us safe, we have to put people in jail, are in fact myths and lies. And when we need to, we can actually remove almost half our prison population with no spike in crime, and actually at a much cheaper cost, showing us that our investment in prisons and policing is not about evidence and it's not about safety, it's about an ideology of punishment, that we just believe in prisons because we do. We just believe in policing because we do, and we cling to the idea that we need to rely upon incarceration. Another reason why so many people could be released, of course, is because we have extremely high remand numbers in the first place. So between 2/3 and 80% of our jail on any one day is not convicted of any crime, showing that we are very much relying on incarceration instead of solving social problems such as access to treatment, housing, mental health care, addiction, beds, etc. So I say that to say that there is a connection here between criminalizing the pandemic and between what we see on a broader level. So when we talk about policing the pandemic, we're moving back into the stage now. I certainly don't miss the stage we were in March and April, where everybody felt that they had to be Officer Karen and police everybody who was walking around outside and call the police on kids playing basketball. And, you know, I saw somebody walking in the park. You know, we entered a stage of social surveillance early in the pandemic where in response to people's justified fear and anxiety, you know, we have a disease, we don't know, you can catch it, you know, that makes us feel unsafe. Human contact becomes unsafe, like the very idea of hugging people or being in the same space as people becomes very dangerous. And when people feel those fear and anxieties, what we see historically and now is that people turn to a policing response to keep them safe. And we saw that during COVID. So people not only turn to the actual police, and we talked about finding people, charging people, giving people tickets, but also people designate themselves as like neighborhood police. So as Rajean raised, there's many layers to why people may not be obeying COVID laws. You may live in a domestically violent situation. You may live in a one-room apartment with multiple generations of family and there's simply nowhere to go. It's quite a lot different if you live in a big house or the yard and your kids have a trampoline outside and you have access to the internet and you can do all those things. It's a lot easier to say, I stayed inside, why can't you? Than if somebody's living in a building and maybe getting out with their kids is the only time in that day that they get any breathing space. So we know that class, poverty, access to housing space, all of these things influence how people experience the pandemic. And we know that the people that get targeted by these forms of social surveillance, both informal and formal, will continue to be the people who are always deemed outside the notion of public safety. So when we talk about public safety, which is interacting with public health with COVID, we understand that the idea of the public is always implicitly racialized in class. What we mean by the public is white middle class property owning people, usually heterosexual, you know, etc. What we don't mean and never have meant is racialized people are obviously imagined outside the public. Black people are imagined outside. Indigenous people are imagined as outside the public. Queer and trans people are outside the public. Sex workers, drug users, people who are homeless, people living with disabilities, people with mental health issues are all implicitly outside of the public, with the idea being that policing those people therefore protects the public, imagined as white and middle class. And so whenever we turn to a policing or punishment response, we know the people who are going to be punished are those people that are always seen as not the public. Furthermore, our idea of safety is very much influenced in relation to that. So we see safety as maintained by things like policing, charging, getting people off the street. I don't feel safe when I go to Tim Hortons and there's a homeless person begging me for change. I don't feel safe when I stop at the intersection and somebody wants to beg me for change in my car. I don't feel safe when I saw that intoxicated person, right? So it all turns into ideas of punishment. What we don't imagine safety as is everybody should have access to housing that is affordable. And if it's not affordable, that should be subsidized and given to you by the state. We don't consider safety everybody needs to be able to pay their bills and have a universal basic income so everybody can live. We don't consider safety to be everybody needs to be able to walk on the streets without fear of being accosted or stopped and people have the liberty to do so, right? Those are not things that we include in safety. Safety becomes synonymous with security, which becomes synonymous with policing. And we can think of this all over in our lives, how often the rationale of safety is used now to really mean policing. Oh, it's keeping you safe in the airport when we scan you. Oh, it's keeping you safe. Protesters get this all the time now. We're arresting you for your own safety because you were blocking the road and it wasn't safe. You were on the bridge and it wasn't safe, right? So safety, instead of being about our actual security and well-being as human beings, becomes about always policing an imagined threat. This is the idea, of course, of the thin blue line, right? So this idea, police just got in trouble for wearing thin blue line patches. And the idea of the thin blue line is a very colonial settler idea. It's quite literally that there's a thin blue line between chaos and order, and the police stand in the way of that. And that's what the thin blue line is. Of course, who is imagined as the forces of chaos? Indigenous people. You know, it's quite literally like a vision of the wilderness, right? And who, you know, prevents you from those untamed, primitive, violent things out there? The police. So again, we see that Indigenous people, Black people, etc., imagined as like out in the wild and kept back. So that very notion that there's a thin blue line, which is not factual, of course. Crime rates are quite low in society right now. We have some of the lowest crime rates we've been experiencing in decades. We know incarceration and policing have no effect on crime rates. They don't drop them. We know that when we build prisons, we actually find people to fill them and not the reverse. So it's not that we have a crisis of people who need to be incarcerated and we have to build prisons. We find more beds and we find the people to fill them. An example of this being in Canada, We used to have not more than 40 federally incarcerated women at any one time when we had one federal prison for women, Kingston Prison for Women. When we moved to the regional model, we now have over 500 federally incarcerated women because we have 5 prisons and 1 healing lodge, and we found women to criminalize to do that. And so who is being criminalized in the last 3 decades? Women with disabilities, Indigenous women. 44% now of federally incarcerated women, meaning women serving more than 2 years in prison, are Indigenous women. Nearly half of our entire women's prison system is now Indigenous women. And we see that as a direct response to the ways that prison has expanded. So when we turn to a policing response through COVID or through anything else, we have to understand that it does not actually solve any of these social problems. Policing homeless people during COVID does not solve social problems. I just saw a story where there's a Black carpenter in Toronto who was making mini shelters out of sustainable materials. So it cost him about $1,000 to put together a shelter in response to the fact that Toronto, and we have this as well, has not addressed the housing crisis. It is now winter. So he's building insulated shelters and putting them in parks and stuff so that people can access them and not freeze to death. And they have threatened him with legal action, saying that, you know, like, you're creating disease because they're going to be in these encampments and spread disease. One of the street nurses was like, I didn't used to support these things because I think the solution is housing and not like building people better tents. But she's like, given that they're not finding housing, these shelters are necessary, you know, and could save some lives. So that's a response that we see, that instead of investing money in saving lives by making sure that people have shelters, instead of even passively sitting back and letting this man just produce some shelters since they have no interest in doing it, they're like, let's criminalize this man for building shelters for homeless people and still not put those people in shelters. And oh, well, they're going to freeze to death on the streets during a pandemic, because we're already also securitizing and policing shelters more broadly in response to that. We know that during COVID, drug users, it's been a disaster on. There are another pandemic crossing with COVID is also, of course, the opiate pandemic. And particularly on the West Coast, we've seen that, you know, the lack of access to safe injection sites, the fact that people can't, you know, use in safe spaces, so are now shooting up in stairwells and, you know, not being able to have access. So we've seen a crisis of drug users in particular and overdoses that accompany COVID that we're not even really talking about because we remove those street-based services under the idea of maintaining public health. So one of the things that it is really important for us to understand that COVID has made clear is our health and safety is only maintained as much as the least cared for person in this society, right? That the failures in our healthcare system, the failures in our system to house people, the failures in our system to adequately treat people, then we have a pandemic and we're like, oh my God, homeless people are spreading COVID. You know, but that reflects broad failures in a sick society that has never cared for people other than those in power and those imagined in the public. Something else I wanted to bring up is, of course, notions of hygiene. The minute hygiene arguments are being used, we know those cross with racial arguments, and COVID is generally captured in a bunch of hygiene arguments. What do I mean by a hygiene argument? Some of our magical thinking around COVID is continues to be the idea that if you got COVID, you must have done something wrong. So it's both a hygiene argument around if you would just wear a mask and wash your hands properly and socially distance properly, you wouldn't be getting or transmitting COVID, so it must be your fault. And we see this in the backlash for every time people are identified, they have to like conceal their information because people are like, who is it? Oh, I saw, you know, so like there's a violent reaction upon people that have caught a disease that is airborne and circulates as though you must have done something wrong or you are not virtuous. So we both get hygiene, the idea of cleanliness, that you just weren't clean enough, you just didn't wash your hands enough. And that's a moral argument as well, right? That you must have not been sufficiently protected, you didn't do what you were supposed to do. And through history, when those two things, hygiene and morality combine, we know who's on the other side, and that is Black people, Indigenous people, the same people we have always socially controlled as unclean. So we are seen as the particular vectors of uncleanliness. There is an idea, a racial hygiene argument, which is that Black people spread contamination, proximity to Blackness, you know, creates criminality. This is the idea like, oh, you listen to hip hop and it makes you a criminal, right? Like our Blackness just circulates in the air somehow and then people catch it and it makes them criminal, you know? So that's why we have to be contained and controlled at all times. This was present in, of course, the reaction to North Preston, right? That once COVID, after being in many, many communities and many other clusters through people traveling, etc., once it was identified in the Black community, we immediately got this idea of Black people must have been irresponsible. They must have done something wrong to catch this. They're the immoral ones, they're the sinners, and they will spread it. So we also got the idea like we have to get on this because this might go to other communities. In other words, people who don't deserve COVID, imagined as white people, will get COVID from the people who caused COVID, imagined as Black people, right? Even though we know that COVID initially spread and has again this time through travel, right? That is actually what has happened. Even though, of course, our government is the one that keeps bars and restaurants open and then blames people for going to them. So we always see this individualization of responsibility. And whenever you move to this idea that you are individually responsible, then it's always the idea that the people that historically have been seen as irresponsible become blamed. The last thing, I don't know where I am in time. How much more time do I have?
Sorry, you have about 10 minutes.
Oh, wow. Okay. I feel like I'm
You got
talking.
lots. Yeah.
I also wanted to identify some of the issues within jails and prisons. Of course, we know that visitation is blocked and has been blocked for many months in the prison, including programs. This has mean that they moved to virtual visiting through a video app, which you have to download onto your computer or phone. We can already see the access issues with that. Not everybody has this technology on internet. Not everybody has the know-how. You may be, I mean, not to say no elderly people or, you know, tech whizzes, but we know that generationally elder people are less likely to be able to do this. So, you know, there's a lot of access issues with that. There's also privacy issues associated with that. I spent my day going back and forth with the province on this because they deny that the terms of use, which is the terms of use, is actually the terms of use, even though people accurately quoted to me the terms of use who are using the tablets. So in other words, they gather your data when you engage in these things and aren't really being forthcoming around what they're doing with it. And we know that that data is going to law enforcement as well. We're not sure what's happening with it because the province won't tell us. So there's also data privacy issues around things like installing visiting apps from the jail, right? That has led to increased lockdown. They're now using a system where you go in, you get tested, and you have to wait about 3 days for the test to come back. During that time, you're in complete isolation. You have no access to showers, a change of clothes, or any human contact. At that point, if you're found to be negative, you are moved to a quarantine range where you spend a further 14 days quarantined before you're finally moved on to a range with population. So in other words, we're seeing people exceeding the limits that we placed on solitary confinement. So we are supposed to be banning solitary confinement in our jails. And there's been, you know, severe restrictions on solitary confinement that continues past 15 days. But just with quarantine alone, we're moving into 14, 15, 16, 17 days of isolation. This is becoming the new normal. So that it's not just a COVID thing. It has interacted with the ways that we have seen increased lockdown and containment in the prison system for many years, including increased remand rates, including more lockdowns, including less and less hours outside. They now consider 4 hours outside to be the most you get. That used to be 8 to 12 outside of your cell. Now you're talking about 4 hours is good, and 22 is standard that they're in their cells. So 2 hours out is now being not considered segregation when in fact it is. And there's much like legal law around that. Accompanying this, we've also seen jails creating other forms of containment, particularly special behavioral units, etc., which they are in concert with the ways that they're able to use COVID to securitize the jail. They are using to put problem people on these ranges with no access to being able to, like, they just decide when your behavior says you're good enough to get out. So it's completely arbitrary and random. And of course, as you can imagine, largely targets people with disabilities, people with mental health issues, Indigenous people, and Black people, who are of course largely being scooped up and placed on these ranges, which the courts are not considering to be a form of segregation, even though they clearly are, because they just like named them a behavioral unit and said it's about behavior and not about confinement. So we are seeing these logics of containment being used more and more, and COVID has really allowed the jails to control contact, to control visits, to control volunteer programs, to prevent access to the community, and to further securitize the jails and prisons. And that's not going to go away after COVID. So for example, right now, this will be an excuse for them to lock down over Christmas, which they love to lock down over Christmas anyway, because the staff doesn't come in. So they're always locked down over Christmas, but now it will be like a public health response. So we have to be really wary of public health responses that claim that security, incarceration, or further containment are the responses, when everything we know shows us that social housing, community living, and access to therapeutics is actually what is important. So we cannot allow our provincial institutions to claim we have to keep them locked up for safety's sake while the guards, for example, come in and out. It just obviously does not make sense. So in general, I think we need to look at the ways in which COVID has revealed to us things, I mean, we should have known, but maybe didn't know about the social gaps in our society, right? We live in a society that does not adequately fund healthcare, which means that workers, largely often migrant workers, immigrant workers, women from low-income backgrounds that are working in the care homes are not being given adequate contracts. And, you know, we're working 2 and 3 different homes, moving between, which helped COVID spread. That's not on the person who spread it. That's on decades of institutional removal of social services that weakened our healthcare system to the point where it made homes for the elderly vulnerable. Right? Many people, some people are in those homes because they want to be in those homes. Some people don't want to be in those homes, but we don't allow enough resourcing for independent living as well. So people often felt they had no options but to end up in a care home. So all of that shows the many, many gaps in pensions, in social services, in the way we treat our elderly, in our healthcare system. Similarly, we've seen this with work, right? Suddenly everybody started to pretend that they suddenly value grocery store workers. Oh, they're such heroes, you know, while like cutting emergency pay, while endangering people in the workplace. Many of the young people that are being blamed for spreading COVID are, of course, young people that have to work in the restaurants and bars. So the idea spread has been that that it's about them going and gathering and partying, ignoring the fact that they are the workforce that is largely working in retail, working in the bars and restaurants, working in the service industry that puts them on the front line of COVID. So we're constantly moving to a narrative of individual responsibility rather than moving to a narrative of collective responsibility. So in that sense, I guess to close this off, I would suggest that COVID is in many ways the ultimate neoliberal disease, right? It's a disease about failures of collectivity, a culture that has told us that our survival is found in pulling up our bootstraps as individuals and getting on and getting as much as we can get, and not in a shared understanding of, you know, how I go somebody else in society. And so in response, for decades, we have weakened social assistance, and that has led to the mass criminalization of women. For decades, we have weakened the basic things of how people pay for their medication because they don't get enough money for that and are having their medications. For decades, we've weakened all of this thing that is collective, that is the public, imagined as you are owed things to the public. And we've moved away from that into this idea that everything is about you and you're the individual. And if you can't survive in this society, there's something wrong with you. And COVID has exploited those weaknesses, and we've seen that it spreads in response to that. A society that has no sense of collective care. So in my bio, it said I was an abolitionist, and that is what abolition is about. It's about moving from securitized and punishment structures into understanding that we have to change our relationship to capitalism, to the land, to each other, to conflict, that we have to confront in our hearts and in our heads that instinct to punish each other, that instinct to dispose of each other, the idea that there are haves and haves not in society, and some people just make it and some people just don't. You know, the idea of capitalist competition, the idea that what happens to my neighbor has nothing to do with me. These are all things that we as abolitionists confront. It's not simply about removing funding from the police or even saying, I imagine we would knock down the prison. None of us believe that that would happen tomorrow. None of us think that would be a practical response right now, because as Rachel Zeller says, we ain't ready. We haven't learned how to do those things. If we got rid of the police tomorrow, if aliens came down and zapped up the police force, we know that private security would just be hired by businesses downtown to keep homeless people away, right? We would do something else, just like we got rid of solitary confinement in our federal prisons, and they promptly made structured intervention units, which are worse than solitary confinement, and they just don't call them solitary confinement. So we know that until we address the underlying issues, whatever solution we say we have will never be carried out in ways that don't harm people, because we haven't changed the ideologies of harm in our society. So as abolitionists, it's not just about where we put our money or moving to service providers or saying, you know, we need to bring social workers in. And sorry to the social workers, but we also have to be careful of carceral care, right? That as we turn away from, when we go, okay, like, let's not have police, let's have social workers, as if social workers don't remove Indigenous women's kids from them. You know, as if social workers don't come in your house and look through your cupboards and like take your child from you. So that is also carceral. Doctors and nurses also call the police on homeless people. We recently saw that editorial by that emergency room doctor who said that, you know, drug users basically deserve to die by the police, and defended that, and that's a doctor. So it is not just policing, right? That when we believe that care is carceral and involved in security, then we see those kind of impacts. So I urge us to move in these moments towards models of true care, collective care, caring for each other, some of which we did demonstrate. and maybe demonstrating again, right? People started giving each other groceries, people started checking on each other. We did have an ethic during some of the worst of COVID last time, where people recognized that we were going to get through this as a community, and that maybe we have to go shopping for our elderly neighbor. That shows us we have these capacities, and that's the society that we need to turn to. We need to turn away from a society that continually designates some people as outside us, and move to one that is in relationship with Indigenous sovereignty, that understands there can be no justice on stolen land, that is in relationship to the land and resources and animals around us, and doesn't see that as something to be exploited and extracted and taken from, is in relationship to each other, and doesn't see other people as a threat to us, doesn't see conflict with other people as something that we immediately need to mediate through security, and that also understands that it's our collective social well-being that brings us safety and security. Police are not safety. Safety is a safe house. Safety is the ability to negotiate conflict. Safety is to have neighbors that look out for you. Safety is to be able to safely send your children to school. Safety is paying your bills. Safety is not having to worry about where your next check's coming from. Those things are safety, and they are based in an ethic of collective care. So that's where abolitionists try to move us towards on a daily basis. And I can end there in terms of what I have to say. So I'll send it to Jackie.
Thank you so much for that, Al. One of the things that I thought was one of the most dangerous lines that the Premier used at the height of the pandemic was to stay the blazes home, which everyone grappled on as, what angry Premier Dad, he's got so much wisdom, but it created that opportunity for that hypervigilance and that policing to happen. Thank you so much for your talk. It's so hard. Everyone's gone a little bit over time, but it's hard for me to come in and say, don't add more, because it's so rich in content, and I think folks are really learning a lot. So with that, I'm going to come to Jackie. Jackie, you do have 20 minutes. Don't worry about time. I'll keep you on track to wrap us up and to give us your final thoughts here.
Okay, well, I have absolutely no intention of taking 20 minutes after listening to Rajean and Chief Paul and Elle. That's just not going to happen. So I just want to start off briefly with the heroes. I think it's really important for us to remember that Loblaws and Sobeys were actually profiteers 2 years ago who were taken to court for basically stealing bread from people across the country when they had collectively monopolized the sale of bread and were overcharging for it. So this is not new. The $2 should be returned, and they're thieves and they're profiteers. Anyway, so thank you, everyone. I guess what I would like to do just very briefly after what's been said is talk about white people. And what I want to acknowledge is that there really isn't anything I've learned about myself as a white person or about white people in general that I haven't learned from people of African descent, Indigenous people who've been in my life and who I've had the honor to listen to. So I guess I mean that as an acknowledgement of ideas and where they come from, and not only the land. So particularly with regard to what I suspect, though I can't see us, us meaning white people on this Zoom, I'm kind of going to make the assumption that the majority of people in the coalition are white people. And, that's not a crime, though we do criminalize racialized people. It isn't yet a crime to be white. But the point that I want to make that I think is really, really important is that those of us who operate in the caring professions or the service delivery professions, or who operate in nonprofit agencies or educational agencies, or who are members of church institutions, like to think of ourselves as good. And we like to think of ourselves as innocent of the issues that Rajean and Chief Paul and Elle have talked about. And sometimes that pretense at goodness and innocence of what white supremacy is really about causes an enormous barrier for us to hear, us white persons, to hear and acknowledge what's been going on, and therefore to participate in changing it. And I think sometimes it's called white fragility, and I don't think that's an unuseful term at all. I think it's a helpful term for us to understand, but more and more I'm coming to think of it as just this sort of bland pretense at innocence, that those of us who are involved in service agencies and institutions, educational institutions and churches, and the list goes on, that somehow we are not the ones who benefited from or participated in white supremacy. And I used to talk about and work with other white people in organizations to talk about white privilege, until a young man challenged me about 5 years ago at a talk and said, why don't you talk about white supremacy? And I said, oh, well, because, white supremacy is about bigotry and the Klan, and people of my generation think of white supremacists as bigots. And most white people are not bigots, even if they're racist. And he said, well, I think you're actually really misunderstanding that concept, because white supremacy simply means that whiteness is supreme. It means that whiteness is what dominates the institutions that we live and work in. It means that whiteness is the default way of understanding reality. And when it's the default way of understanding reality, white people don't even see the racism and white supremacy around us, because whiteness is simply the normal. It's the medium, it's the most, it's the sea that we swim in. And so I think until, as white people, we can begin to come to grips with that, some of the best intentioned suggestions and ideas that we have will be weakened by that essential blindness. It's not a color blindness at all. It's a blindness to how powerful the way we look at reality imposes itself on our institutions, including the good institutions. Chief Paul, I was very moved when you talked about the price that you didn't put it that way, but you talked about the consequence of the price that you had to pay after the decision was made to close Boat Harbor. And I was thinking, Rajean, of the price that many, many Black women and men have to pay over and over again, simply for speaking up, or simply for being exhausted at the relentlessness of the daily impact of racism. And so, as white people, because we don't identify with 400 years of a pandemic of racism, we think that this current horrible situation and the sacrifices that we have to make in it, we as white people have to make in it, are this unusual and terrible thing. But they're unusual and terrible for those of us who have had the privileges associated with being white, and going away to winter and getting food whenever we wanted, and having enough money to have access to housing and to a vehicle and to all of the things that make life livable, all of the things that make life not a daily exhaustion. So I think that if there's anything as white people that we need to learn during this pandemic, is that it's way older than we thought, and that the experience of being closed in and locked up and away from the people we love is actually a long, long historical experience of racialized and colonized people. And our 7-month experience of it is pretty small by comparison to the 400 years. So maybe I'll just stop there and let other people comment and talk. I don't know how that's supposed to go, but
yeah. So thank you, Jackie, for I think grounding the 3 presentations that we heard into the work that, particularly, and you're absolutely right, most of the folks who are working on the coalition are white, are folks who are don't have the same depth of experience or understanding of what 400 years of the suppression looks like. So thank you for connecting that to us. So we do have an opportunity for some questions. I see Colleen has raised her hand. Colleen, did you want me to allow you to talk and you can ask your question? There you go.
Okay.
Yeah, you're there.
Oh, okay. I'm just blown away tonight by everybody that has spoken. This is my second Zoom today that's talking about the same thing. I was on with one from Cenevex and changing systems and in inviting an inclusive African descent and Indigenous people into the community and the need for systemic change. And I have for a long time thought that we have to change attitudes. The racist attitudes, all of it, to bring about the change. We can change policies, but policies are not going to change until attitudes change and that people are valued. And in many situations, people are not valued. Our heroes in the grocery stores, the unsung heroes. Well, why are they unsung? And why are they heroes now and they weren't heroes before? So it's how we value people. And one of the quotes recently is like, maybe now people will learn that we live in a society, not an economy. And I think if we think about living in an economy, we value people for what they have to offer and not what they're contributing to the GDP.
mm-hmm.
So I believe in that. But Jackie, your point just sort of struck me again, is it's white supremacy. And that honestly just caught me, that's what we're talking about. And I have talked about my white privilege. I'm trying to understand it and acknowledge it. But again, it's the supremacy. So I don't know, the question might be, is it the attitudes and values that people hold that need to change? Or is it the structures of the white supremacists that needs to change? And I guess maybe it's all together. So I'll just throw that out there, but I'm just blown away by this. Thank you.
So does anyone on the panel is more than happy to jump in and to maybe take up Colleen's question there?
I'm pointing at Jackie.
Okay, I'll jump in. Colleen, thank you for your comments. I guess what I've been taught over many years is that the people that we have oppressed, at least the people I've talked to who we have oppressed as white people, really don't care if we change our attitudes as long as we change what we do. So whether we like everybody or not is irrelevant, as long as we could start instituting some justice. But I do think the attitude is important only to the degree that it's the attitude toward who we are that needs to change. So very respectfully, Colleen, if you don't mind. So one of the questions I think you meant, and I can somehow tie myself and other people up into knots over language, but you said, you're in a program where you're trying to understand how to invite people into a system. And it occurs to me that what we need to understand as white people is that it's not our place to invite people into our system. It's our system that's been causing the problem. So even if we can tie our brains around the fact that it's not inclusion into what exists that has to happen, it's a dismantling of what exists and a recreation of it with people, if that makes any sense.
Mm.
Anyone want to pick up on what Jackie was saying, Rajean?
Yeah, no, I like what you say, Jackie, about white people having to change the attitudes they hold about themselves in terms of being superior than another group. And I think, it's the attitudes, it's the beliefs, that's what created the systems that we live in today. And so I think we have to do a combination of a lot of things. But as Elle was saying, we can't necessarily just focus on the individualization of attitudes and things. And Elle talked about that a lot more broadly than I'm not going to repeat all of that now, but I think we have to think about how these systems were created, which as a result of attitudes, belief, values. I'm better than you, and that's why I get to access this and you don't. That's why I get to have a quality of life that includes A, B, and C, which Jackie has alluded to, and you don't. And so to dismantle the systems, we have to challenge our attitudes, beliefs, our biases, which, our conditioning really, that, these things have been embedded in us. And also within, I would say, people of African descent that internalize racism piece too, which, we have to begin to challenge in a way that allows us to see ourselves as, just as, I don't want to say just as good, but those types of attitudes have been put upon us as well. So I'm speaking from my own self and things that I've heard in that sense, but I think it's a combination. There's a comment in here, and I don't know if anyone else wants to speak to this, but I was kind of thinking, like, to me, when I think about white privilege, white supremacy has brought about what we know to be as white privilege. So it's like white supremacy, as you described, it's the superiority of whiteness, Eurocentrism, and white privilege is what you get to live with because of that. So yeah, I guess this comment, I don't know if everyone can see the comments, but Rhonda, hi. Yeah.
I also would like, could I just jump in? Would that be all right, Alex?
Go for it, Jackie.
Well, and I'm jumping in because I noticed that Sandra Henniger is on this call, and I think she was my boss about 15 years ago. I'm not sure if it's the same Sandra. Anyway, what I wanted to say is that a lot, in particular, like, we really romanticize Nova Scotia, and I mean, I love Nova Scotia, but we really romanticize it, right? Like, so I snuck in to try to finish just a tiny bit of shopping for some presents for my sons, one of whom, Chief Paul, is going to be 50 3 weeks before you. And I went into this lovely store in the Hydrostone, and it's so pretty and it's so cute, and there's, kind of little white angels everywhere, and little white fishermen everywhere, and little white everything everywhere, And here was this beautiful book on Nova Scotians and how we got through the pandemic. And I opened it up, and I was going through it, thinking of buying it, until I realized there was one Black face and no Indigenous faces. I mean, I didn't go through all of it, but it was like Nova Scotia is so white, Nova Scotia and tartan. And we are much more complicated than that. And I don't mean that people shouldn't have our cultures. I mean, I'm a French person. I value that. People of Scots and Irish descent and Acadians, we all have cultures that we belong to, but we need to know those cultures have had a different impact on people than they've had on us. So anyway, sorry. So the point I was trying to make, sorry everybody, the point I was trying to make was that we live in a province where the culture of obedience exists. And even when white people in our institutions, and definitely Indigenous people and people of African descent, working in institutions, we actually are not allowed to say what we think. So even as we begin to dismantle our institutions, to actually speak openly, as Chief Paul said, in having to negotiate with the provincial government, or in Black organizations having to get money from the provincial government or the feds, there's this there's this price of silence that has to be paid in order to get things that people should have a right to. And I was reminded of that because when I worked for Sander, I said what I wanted and didn't feel shut down. It was just a personal experience.
Thanks, Jackie. I'm going to come to Vicky, who has her hand up, or her digital hand up, who wants to ask a question. So Vicky, I'm going to give you the capacity to ask your question.
Yay, thank you so much. And I'm fangirling right now because I love you all. Oh my God, fangirling so hard. But that was not my question. I have a disability. I do a lot of disability advocacy work. And one thing I've noticed over the past 10 years of doing it, like as a job, it's very, very white. There are not a lot of Black or Indigenous voices in disabled circles. I go to all these meetings, everyone is white. So like, my question would be, how do we ask Black and Indigenous people to come join us without making it feel like, oh, we're giving tokenism? Because they exist. I never met one until I went to university. I'm like, oh my God, they're Black disabled people. It's like, I've never seen one.
I guess I'll take some of that.
Yeah.
I think, and again, not that movements by people with disabilities is new. I'm not implying that, but I think in terms of people naming and maybe the visibility of disability justice movements is relatively recent. So I think part of it is that we haven't done a lot of work connecting disability activism to other movements yet. So my friend Adil is, working in disability studies as a Black woman who connects like disability studies to incarceration and policing and Satanism and all of these different things and institutionalization. But I think part of it is that as the movement's growing, we haven't necessarily done the speaking publicly about like, this is why disability intersects with Black Lives Matter. Like Black people are much less likely to be diagnosed. Like we know that the Somali community has high rates of autism. I'm not saying autism is a disability. I'm not applying like the disability model necessarily to that. But we know that the ways that people are socially disabled through social models of disability and health also is impacting Black people, racialized people, Indigenous people, but not necessarily in ways that are articulated yet. I think that the narrative of also disability is difficult for like Black people if you're fighting against a school system that always wants to see you as like incapable. So then people don't necessarily want to get like a diagnosis for their child, and people aren't necessarily going to wear some of those labels because it's seen as a labeling that's going to push you out. So I guess one thing is to say that yes, on the ways that as we, like as disability justice movements grow, that's like a really important point you raised, that it has to also understand that those movements need to do the intersectional work to understand that like disability and Blackness are connected, right? The institutionalization of people with disabilities and Black people and Indigenous people has always been connected. The narrative around who is disabled and who is not human is very tightly connected to narratives of racism and white supremacy as well. colonization also removes disabled bodies from the sphere of who is human, right? So there's a lot of connections that we can do. I just don't think we've necessarily done a lot of them, and like we need to do more work on those solidarities, both those within the disability justice movement and those of us in other movements, recognizing how often ableism is structuring things that we're not talking about. So when we talk about school discipline systems, that is often intersecting with ableism. It's neuroatypical children who are being targeted and removed from the classroom. And then that intersects with being Indigenous as well, right? So I think it's a really good point. And I think it just is around us doing more work on all of our ends. The prison movement, right? We know that prison intersects with disability. Over half of women in prison are women with disabilities, but we haven't necessarily articulated that as a disability justice issue, right? So some of it I think is in naming things and then doing really proactive work with each other to say these are how our struggles connect. Like they're not all the same, right? It's not always going to look the same, but when we take an intersectional lens, we're like, these are the ways that we share moments of struggle and that we should be advocating together. So that's a long answer, sorry, but that's my best answer.
So we have a few more seconds.
I just wanted to add too, I'm actually the health lead for the chiefs in Nova Scotia. And so we have a lot of conversations around the disabilities and in the healthcare system. We have, you talked about the fine blue line. We have the fine jurisdictional line, which is, it has impacts to all parts of our life, right? Because we're on federal lands, a lot of programs are provincially run. So there's an access issue there. So I don't know, you know, Vicky, when you talk about, you know, how to bring us together, I don't think there would ever be an issue of bringing us together, but I think at the end of the day, there would be issues to access for First Nations people. And so I don't know how many people know about the Jordan's Principle fight, which was, so that was in my community that we fought that and won it. So we have those issues. VON, we can't have VON come into our communities, right? So until we enter into these service agreements, or another one that we have is palliative care, or after treatment. There's so many programs that are offered to Nova Scotians, which are not offered to First Nations. And so we often have to remind the province, we're Nova Scotians too, right? And so there's that jurisdictional line that really gets in the way of access and full health care that other Nova Scotians have the ability to do so. We don't have that same access. And I don't know if a lot of people understand that, but when I sat on the Human Rights Commission, it was one of the issues I brought forward was the access to healthcare and the jurisdictional line that will either create an opportunity for access or it'll shut it down. And it all has to do because it's a provincial program and we're on federal lands. So that's an issue right there. So I just wanted to kind of talk about that, but I think that we need to have a lot more conversations about disabilities because our members, we don't have home care systems where we can, you know, we don't have those options in our community. So people stay in our communities, and then it's often a fight as to how we're going to support the families financially to do that, right? Because people have to work, and but we can't access those provincial programs to do that. So it's very complicated, and there's a lot of programs that we as First Nations people don't have access to.
Vicky, I'll just mention too that the Association of Black Social Workers has done some work around the intersectionality of race and disability. However, you know, it first we need to have the conversations within our communities to, you know, acknowledge that, you know, having some sort of ability limitation isn't necessarily a limitation, or isn't necessarily, it's a taboo topic. And so, you know, a lot of the preliminary work is around trying to create some normalcy around alternative ways of moving and living in this world, right? And so more recently, we are going to be doing some more things. So, you know, you can always reach out to us and see if there's ways that we can collaborate based on, you know, where you're representing. And yeah, we can chat further about that if you're interested.
Can I make a small comment, Alec? Because I know you're probably going to shut us down soon.
Very soon, yeah. Go for it.
Just a really, really quick comment, which,
Yeah.
you know, I used to belong to an organization that was a coalition of white persons doing public education and activism work to try to change the perceptions and behavior of white people by other white people, not making racialized people have to do that work constantly. So I just wanted to say that if there are organizations in your coalition or groups of people who want to actually talk about deconstructing issues of white supremacy and colonization, there's a new growing group of young people as well, young white people who are also going to start to do that work. And so I just want to offer that availability to people.
Thank you for that, Jackie. I really want to thank all of our panelists and speakers tonight. I think you can see from the comments, if you can see those, that folks thoroughly enjoyed the presentation. Minds were certainly opened to the challenges as well as the potential. I just want to say a quick note about the work of the coalition moving forward is that, you know, we've had 4 webinars now that have all been intersecting in terms of these issues and the challenges that we face. But what we've heard throughout them is that the policy options aren't as complicated or as far away as we think they are. You know, I'm struck by Engage Nova Scotia has been doing surveying of Nova Scotians about quality of life and what they want to see in that. And through those surveys, they've shown that Nova Scotians are more interested in policies and politics that improve their quality of life. I think the number was 80%, than they are about continued pursuit of our political agenda around economic growth. So there's a dissonance there, cognitive dissonance there between what people want, the perspectives that they have, and how we connect those. And so I think the work that our panelists tonight have helped us do, and what we hope to continue, is to try and make that connection for folks, that the policy options are there. They're not that far away or far removed, but it does take, as Al mentioned, a paradigm shift and a reframe of how our relationship between our public and our private and our community sectors. So stay tuned to the coalition. We are hoping to build all of this into some campaigning and help with that connection. Again, big thank you to all the panelists tonight. We appreciate your time, and I'll let everyone go now. So thank you.
Bye.
Thank you, everyone. Thank you.
Take care.
Thank you.
Thank
Bye.
you.